This is a scene familiar to most of us. The hallway of a hospital. Clean, well lit, with doorways leading to sanitized rooms and other hallways that resemble this one. Now compare this hallway to the last. Not very similar. Nonetheless, this is a hospital hallway, though this one is in Western Africa, in the country Gambia. Unlike the hospitals most of us are accustomed to, the hospitals you are about to see have unreliable electricity and questionable water. It's hard to imagine being cared for in these type of conditions. There is no brightly lit operating room with running water, just a dark, cold room where often the only light the doctors and nurses have is that given off by candles. Unfortunately, this is a scene repeated in hospitals throughout this poor nation. Gambia is a small country in Western Africa. Smaller than all of its neighbors, it measures only 4,007 square miles, roughly the size of Connecticut. Gambia is the smallest country on the mainland of Africa. Gambia gained its independence from Great Britain on February 18, 1965, since changing its name to the Republic of Gambia. Up until the early 1990s, the majority of the population resided in rural villages. But with an increase in technology and education, the youth of Gambia have migrated more to the capital city of Banjul. Though the capital offers many of the same amenities as other more developed countries, the hospitals that lie outside the city and serve approximately half the population are forced to go without. Hospital staff and the government of Gambia do what they can to correct the problems they face, but unfortunately are practically powerless due to a lack of funding. With an average income of only $290 a year, private citizens and the government lack the financial resources necessary. Most Gambians are laborers, with the main exports being peanuts, peanut products, cotton, fish, and palm kernels. With income levels being so low, there is not much for the government to tax. This results in government facilities often being those hardest hit by the financial shortfall.
I've never seen such suffering and deprivation before.
The differences between the diseases and the pathology of what I see here versus the US is, one, I see tropical diseases that I don't see at home.
So I rushed into surgery, which is exciting enough, and then they got the baby out, but they were too late. And that was because they just couldn't get the electricity on fast enough.
Every day you learn new things. If you don't catch up with the times, and this change is constant, you are left behind.
It's a very, very difficult environment for somebody from the West going to. We have temperatures in excess of 50 Celsius during the months of April, May. It's a hostile environment, no electricity at night, candlelight only. The smells, everything was just totally overpowering.
Here in the United States, it seems like, everybody has electricity, everybody has water, why wouldn't you? But the truth is, when you're far from the grid, far from the capital, and you don't have the basic resources of oil and gasoline to run the pumps and generators, you just can't access water, and you can't power a generator for the hospital.
I am Keba Baji. I am the CEO, which is the Chief Executive Officer of the hospital. When I started it up, it was a hospital that had no power, it had no water. I used to call it a malignant generator. A generator that you put the power today, it tells you yes, it succumbs to what you need it to do, and within 2-3 hours, it has a breakdown.
So most of the time, something that needs to be done urgently is always delayed, because we have to call the generator operator who doesn't actually stay within the hospital. stays outside the hospital, and it takes almost an hour before we get everything started to resuscitate that person. Imagine if that person has cardiac arrest. The person is going to lose his life.
Well, we have a catchment area of 150,000 reaching out for this place. But we also see patients in the sub-region as well, because countries in the sub-region like Senegal, Guinea, Guinea-Bissau, Sierra Leone, Mali, Mauritania, all access this place because healthcare in the sub-region is more accessible, more affordable, and more available in the country than the rest of the other parts. Now, imagine a hospital with no lab, no pharmacy, no theater, and the archival table at the outpatient department used to be the table that divided into two parts. Half of it is where the nurses can see patients and diagnose, and the other part is where you have drugs and dressings to take care of the patient. That was all I had.
Some of the challenges that this hospital has is there's no native physicians here. They have to rely on international support, be it volunteers that come from around the world, or they also have Cuban physicians that come here for 2-year contracts. And the problem with the Cuban physicians is they don't speak English, which is the national language here. They also, for periods of time during the year, go back home on holiday. So right now in January, there's no physicians here because all the Cuban physicians have left to go home on their annual leave. So this is a big challenge in the Gambia, particularly at this hospital, where they have long periods of times where there's no physicians here.
As the principal nursing officer, I am in charge of all the nurses who are working within the hospital. And also as the clinical head I am also responsible of all the clinicians, including the paramedics, the medical doctors, and at the same time also the nurses and the nurse attendants who are working here.
Well, my name is Ulrich Jones, and I'm a consultant general surgeon and neurosurgeon. I'm a visiting surgeon to Buyam Hospital on invitation of the administration to assist in future developments of operating theater facilities in the hospital. I come here usually once a week on a Saturday, and I do operations on cases that have been properly programmed and worked up and are fit for surgery and have signed consent for surgery.
So we started building up the hospital, started getting another generator which can now push out to give 4 hours of electricity, 2 hours in the day and 2 hours at night, at least to encourage the staff and also to enable the staff to be able to do some work at night. But what was more appalling was that if they want to epistomize a patient at the maternity, they do it under candlelight. You have to put up a candle and you have to suture the private parts of a patient.
So any case that comes within that time when the light is off, it is attended to in darkness. Most of the time, either through what we call torch lights, this battery torch lights that we use, and then supported by candlelight, which we know is definitely not very sufficient light that is produced.
It was so appalling, so absurd, so discouraging that efficiency and effectiveness was kind of compromised in so many things. And nurses, when they see patients, they find it difficult to get potable water to wash their hands. Such was the situation here, honestly.
I'm Catherine Hall, and I'm the founder of Power Up Gambia. It's an organization that I started 4 years ago, and the goal was to provide electricity and water to the Suleiman Junkun General Hospital in Buyam in the Gambia, and that's kind of where this all started. I was sitting at home, and all of a sudden the electricity went on because they have a generator that works for some hours of the day, and it went on, which is very unusual. And so I ran over to the hospital to see what was going on, and they turned it on because there was an emergency C-section that had to happen. So I rushed into surgery, which is exciting enough, and then they got the baby out, but they were too late, and that was because they just couldn't get the electricity on fast enough. So the baby basically suffocated in utero because they couldn't get to it fast enough.
When it comes to resuscitation also, the newborns, now, sometimes we have difficulties in resuscitating them because the suction machines we have, we are using electricity. And then with those suction machines that uses electricity, when a newborn has asphyxia or difficulty in breathing, or he has some secretions in the mouth, we find it difficult. So what nurses usually do is they use a tube and do what we call mouth-to-mouth suctioning. They just use a tube, put it in the child's mouth or in the nostril, and then try to pull it out, which was not very effective. And as a result, many neonates usually might actually have difficulty in breathing after birth or might eventually lose their lives.
The deficiency in essential resources required by doctors and other medical professionals make it nearly impossible for them to properly perform necessary procedures. This is undoubtedly one of the underlying causes of Gambia's low birth rate. Gambia has an infant mortality rate of approximately 84 deaths per 1,000 births. This is a clear illustration of why sustainable natural resources need to be brought to the forefront in the healthcare system of Gambia. After returning home, Hall felt compelled to take action. This need to act is what led to Power Up Gambia, a non-profit organization dedicated to bringing solar power to the hospitals and medical clinics throughout Gambia.
This whole project started because the CEO of the hospital in Buyam asked me to provide them with electricity. He goes, here's a quote for $300,000, that's what we need for a solar energy system for the hospital, which is a really powerful concept.
I wrote this project of solar and sold it to her.
It wasn't me barging in saying, oh, you guys need electricity and you need solar panels. It came right from the hospital administration. Electricity and water are just so hard to come by. I mean, here in the United States, it seems like, everybody has electricity, everybody has water, why wouldn't you? But the truth is, when you're far from the grid, far from the capital, and you don't have the basic resources of oil and gasoline to run the pumps and generators, you just can't access water and you can't power a generator for the hospital. So we decided that we were going to pitch in and help out with electricity and water at SJGH. We knew we wanted to provide the hospital with water. That was something that they desperately needed for the surgeons to use to scrub in for surgeries, just for hand washing, sanitation, basic things. So we started by installing a certain number of panels just for the water system.
So one of the first projects that Power Up Gambia did was to put in solar panels, a solar pump, and 3 5,000-liter water tanks to supply water for just the hospital, not for the village.
And that went really smoothly. So that kind of gave us the confidence to do the additional 96 panels for the tracking systems for electricity for the hospital. So that's how it all started.
My name is Andy Fisher. I'm a second-year medical student at the University of Pennsylvania, and I'm also the technical director for Power Up Gambia. As technical director, my job is to look through the assessments that are provided to us by companies that have done on-site assessments in the Gambia and match up funding and some of the ideas and the visions that we have for the types of projects that we want to implement with the assessments that they've provided for us.
My name is Anita Smith and I'm the founder of the Bansang Hospital Appeal. I first came out to the Gambia on a family holiday in 1992 because it was guaranteed to be sunshine, but I have to say nothing prepared me for visiting a developing country. It was Easter, the schools were closed, and we were invited to take all our pencils that were intended for school children to the Royal Victoria Hospital. And we went to the children's ward there, my daughter, my mother, and I've never seen such suffering and deprivation before. And we spent many days in the hospital, and it was one little girl in particular that I became very close to. Her name was Jaina. Jaina was in the hospital. She'd been there for nearly 3 months, and she'd had a concrete slab put on top of her to stop her crawling out of the compound. Her parents apparently couldn't afford to feed her, and I'm sure this was done in ignorance. But it was a turning point in my life, because I knew that I couldn't return home to a very privileged life that we have in England and do nothing about the suffering that I was witnessing in the Gambia. So I arrived in Bansang Hospital, and I was absolutely shocked by the fact there was anything up to 4 children in a bed. Medical cases, surgical cases, no electricity at night, candlelight only. The smells, everything was just totally overpowering. I went to the operating theatre, and they actually had leather straps attached to the operating table because they were only using ether at the time. There was a rat in the corner. And all of this was quite overwhelming. And I think what really got to me is that people who trek for many miles for help arrive in Bansang Hospital to find that there wasn't the medicines, there wasn't the staff, the number of staff that were needed, and basically the mortality rate was very high. 1 in 4 children were dying before their 4th birthday. So all in all, I came away extremely depressed, thinking this mountain is too high for me to climb. But you cannot come away from the Gambia, from these wonderful people who have so little but are willing to give you everything and share their last crust of bread with you, without doing something to help.
Since returning from Gambia, Smith formed the Bansang Hospital Appeal in an effort to improve the standard of care received by those at Bansang Hospital.
So in 2006, I went on a safari in Kenya with my family, and that experience led me to want to come back to Africa to use my medical knowledge. So I had to find an outlet for that. So one day I was reading my newspaper at home, and I saw an article about Power Up Gambia, and Catherine happens to live in my community. So there was a phone number at the bottom. Called, and I said, hey, I think I can help. And the next thing you knew, I was having a fundraiser at my home, and it was so successful that they asked me to be on the board of Power Up Gambia.
Now, the idea of trying to beef up the staff strength, especially doctors, came into being, because doctors were hard to come by, and they were nowhere in this country. And I contacted my nephew, who is in Detroit, who knew Lonnie, and Lonnie came in contact with me. So I sold the idea of her coming up with the idea of a rotation, doctor's rotation.
So Delmed Aid for Gambia was a sister NGO, non-government organization that was founded after my involvement with Power Up Gambia. Once I became involved with Power Up Gambia in their initiatives to bring solar energy to this hospital, I decided that another need that the hospital had was for medical volunteers. So Delmed Aid for Gambia's focus is to bring medical volunteerism to the Suleiman Junkung General Hospital.
In the hospital level, we can call ourselves dental assistants, but we do more than dental assistants, definitely. Because we did extractions, we did filling, we did scaling, and we give oral health talk to almost all our patients.
The differences between the diseases and the pathology of what I see here versus the US is, one, I see tropical diseases that I don't see at home. I also see things like tuberculosis that I don't see much at home. And I see untreated diseases that I see at home that are very well treated. So you see very poor outcomes of diseases such as HIV and AIDS and untreated cancer and untreated tuberculosis because they just don't have the means to take care of very critical ill patients. But I have to say that the senior registered nurses here are very experienced and very well trained, and actually can teach you a lot in tropical medicine. I mean, it's amazing what they do with so little.
My first posting in my country was to work outside the capital, and it taught me how to use my brains. Believe you me. He taught me how to use my brains. He taught me to see that it's not just you, the surgeon, that matter. The power electricity engineer was important. The guy who ran the waterworks was important. Everybody was important, and we had to do what we call intersectorial collaboration to survive, all of us.
My passion is serving the people. I grew up in a small village about 240 kilometers from here. That's, further down. I went to school, no shoes and all that stuff, but I was lucky enough to make it through, elementary, make it through high school, and make it to America. And my going there is to better my education, to advance my education. And the whole idea behind that is to be able to come back and impact the community, have impact on people. Because I was in America, I did construction for 10 years, and I was making good living. At some point, I thought about it that it's not about me, it's about the people. And that's what led to my going to school. I started community college, then from there, I was fortunate enough and worked hard enough, and I made it to Georgia Institute of Technology at Atlanta. And I chose civil engineering also because I relate that here in Gambia here, after I finish all my studies, I'll be able to impact a lot of communities here with what I learned and with the experience I have on the ground.
Opportunities like Jibril's are not common for citizens of Gambia. Through the nonprofit organization A Hand in Health, founder Megan Meyer is working to improve dental hygiene and literacy throughout the country.
So she comes here every year with some dentists, and they give also selfless services.
Yes, we have a lot of dental problems in the country, and we have a lot of bad oral hygiene also. Because I think why people are not sensitized. People don't know how to take care of their oral cavity, how to take care of their mouth. And most of the people, when they have dental problem, as I tell you earlier, they don't know when to visit the dental clinic. So they will be at home until when they have big abscesses, which is very late. You cannot do any treatment at that time. You have to give antibiotic to those patients. And when the abscess is gone, you don't see them anymore. So this is another problem. When the guys are here, Megan and the guys, they give a lot of toothbrushes and toothpastes, which is definitely helping them because we demonstrate in the clinic here first. They have to brush here in our presence. We demonstrate it to them and they will do it in our presence so that we know that they will continue at home.
A Hand in Health has also become involved in providing materials to aid in and improve educational opportunities for the people of Gambia.
We don't have a reading culture. And I want to break that. I want to revolutionize that. I want to get the Gambians to develop a reading culture, especially, most specifically in this hospital. So that, because I know even if you are the best trained doctor, the best trained nurse in this world, you don't read a book, you don't attend a conference, you don't write an article, you don't attend a workshop, for a year you are archaic. You are just like a person who has not even gone to school. Because, you see, you have to be on top of things. The world is dynamic and revolutionary. Every day you learn new things. If you don't catch up with the times, and this change is constant, you are left behind. So the best thing to do that was to talk to Megan, and I said, I want a library. How can we get books, manual things, to bring? So she also took it up, and she spoke to this Books for Africa, and that's how we had a library.
Megan and I are planning for more books. We have 1 million book fundraiser coming up. And what I see here, there's no room for it. So there has to be a storage where when the books come, that's where they're going to be put and then distributed to the different places.
But the genesis was not only to have a library, but also to develop a virtual library.
They need computers here whereby people will be able to, they will be able to put all the books in the computer and have a record of it, like create a separate folder for each let's say chemistry, have a separate folder for that chemistry, and how many books are there, how many people have used it. This all will help to track out how effective this program is, how effective the project is to 1 year down the road.
Now, if the staff here are now open to reading culture and they adapt it, we might be the best hospital in the sub-region, because the nurses, the doctors will be on top of things. They will be able to provide quality care. And when you talk with authority, because you know what you're talking, you have the stuff, and the challenge is huge. That's the kind of hospital I want to build.
Anita Smith is one of the most amazing women I've ever met. She spent the last, I think, 18 years now working at Bansang Hospital and working with the community there to really build up the hospital. And this hospital, I mean, Bansang Hospital is in the middle of nowhere. I mean, this is like way up country, way up river.
Bansang Hospital is a very, very difficult environment for somebody from the West going to. One particular year, I arrived and I actually counted 43 rats in my bedroom. It was a terrifying night for me, one that was so bad I couldn't even get off my bed. And the following morning, my case was packed. I wanted to go home, but I went onto the children's ward to say my goodbyes, and I then realised the extent of the problem. And that evening, the rats had climbed the drip stands, they'd bitten into blood bags, dextrose bags, they'd bitten children. So on my return home, I contacted the British Pest Control Association, and after 3 months of research, they returned with me to Bansang, and after a very simple test, they were able to establish that on the children's ward alone, there was 1,500 rats. So these are the sort of problems that we're faced with. The old children's ward was a nightmare, and my big dream was for a new children's ward. I go to bed, and in my thoughts before I went to sleep, I'd be placing where I'm going to put beds, separate surgical ward, medical ward, neonatal ward. In my dreams, I'd be dreaming about this hospital, this new paediatric ward, and I never thought it would come to fruition. But I'm pleased to say that with the support of people back home, in less than 12 months, we'd raised the funds to build a purpose-built paediatric ward in Bansang Hospital. It's an 80-bed unit, separate surgical, medical. We have play therapy, which I'm sure is probably the only specialist play therapy unit in a government hospital for sub-Saharan Africa. And to see the difference that this ward makes, I don't think anybody would walk into our new children's ward without smiling. There's beautiful artwork around the place. But of course the important thing is that we are saving lives. The reduction in child mortality has been absolutely staggering. And we only have one child to a bed now, so there is no cross-infection. No child is dying from cross-infection on this ward. One of the biggest problems, and it is still the biggest problem today in the hospital, is infrequent power. We have no electricity at night, we have no electricity in the afternoons, and of course we're relying on a backup generator for emergency surgery.
We're going to help by putting in some solar panels and additional batteries there so they can have electricity and water to help really grow their hospital.
As it is now at the main hospitals, any patient that wants to come for services pays an amount of $5, which is equivalent to 20 cents. And that covers all of the healthcare services that they might require that stay. And if they're able to afford more, then they may be asked to pay for a little more. But also, if they can't afford those $5, that 20 cents, then they still get healthcare service regardless of their ability to pay. And also, the Gambian government just doesn't have the money to keep up with the repairs of these healthcare outposts that are located all over the country. Our ongoing mission is to make sure that we get healthcare services down to the rural level, down to that, to that mother and child who can't make the long trip to the hospital, to any person that's in need of care, to see that they can achieve it through providing electricity and also manpower and other healthcare resources that these places need to be able to do their job.
So as the hospital is growing, it's clear that the system that we've installed is not going to be enough to supply all of their needs in the way they're using it now.
Since 2006, Sulayman Jonkung General Hospital has increased significantly in size, and especially since the installation of our first project, it's grown tremendously in terms of the patients that it's able to accept and the services that it can provide. And as you could imagine, the project that we initially installed for them is not quite ready to meet the full burden of demand that they have now.
We're here at the village water supply, the village of Guiam. This is their water supply. The large tank here was put in a number of years ago, but has never really functioned, and people were still relying on the wells where you pump it by hand. Those tend to be shallower wells. The water is not as reliable and not always as clean. So what they've done recently is they've installed a new water tank, and it's this steel tank here that I wanted to come and take a look at. Now what we found out, now that the hospital's been here for a little while, they're seeing more and more and more patients coming. They're up to almost 300 patients a day. So the tanks that we put in previously aren't large enough now. We need more water.
As these services that they're able to now provide because of the electricity that they have available, it's also increased the demand. So it's sort of a constant chase in terms of keeping up with the needs of the hospital.
We want to be involved in the long term, not just one little project and leave. We want to grow with the hospital, help them meet their needs as they continue to grow. So actually we're delighted that they've outgrown the small system. The solar pump that we put in and the panels that we have put in actually have excess capacity. So the limiting factor now is the storage tanks. And that's why I wanted to come and look at the new village metal storage tank, because we might be interested in getting something even that large. I wasn't initially thinking of something that big, but I'm curious to learn more about it now.
My biggest challenge as a medical volunteer recruiter is to convince people to come here, to convince people to not have a fear of taking that first step and saying, I'm going to do it.
I truly believe that every one of us has the ability to make a difference to somebody's life. And if I can do it, then I'm afraid anybody can do it, because I left school at the age of 15 with no qualifications. And to see the difference that is being made in Bansan makes not only me happy, but of course the whole community and the staff as well. So please, if you can help in any way at all, you can make that difference to these lovely, lovely people here.
I just feel that medical treatment is not a luxury, that the people here deserve the same quality care that I provide to my patients at home.
Whatever they put into this project will serve the purpose. Whatever is donated, whatever help is, whoever volunteered in this project is worth it. They'll see the results and it's worth doing. So again, whoever get to hear this message, I thank you, but I urge you to do something. People need it here.
If we're able to get supplies like panels, small electrical components, anything that anybody's willing to donate us, it not only saves us time and money, but it allows us to get projects on the ground faster, and time is saving lives.
The work that we're doing, I truly believe, is extremely important, and I believe that we really are making a difference on the ground in the Gambia. And it's clear that one of the strengths of Power Up Gambia is that we work directly with the community on the ground. There's no middleman. We're not a large organization with a huge staff. I mean, we really get the job done. And the best way for people to help out is really to visit our website, learn about all the different projects we have going on, and really get involved, either help us by volunteering time. We need solar technicians and technical help all the time. And then really it comes down to our fundraising. If we can raise the money to make these projects happen, we really will save lives in the Gambia.
Many Maiko gongana la molu salam baria. Maiko gongana la molu salam baria. Moji ko mu moti, mo baro mu moti. Maiko gongana la molu salam baria. Moji ko mu moti, mo baro mu moti. Maiko gongana la molu salam baria. Maiko gongana la molu salam baria. Moji ko mu moti, mo baro mu moti. Maiko gongana la molu salam baria. So mo manti mbulo mu maiko menti. Maiko gongana la molu salam baria. Desemela mola mu meji kote menna dunia. Maiko gongana la molu salam baria. Moji ko mu moti, mo baro mu moti. Maiko gongana la molu salam baria.
For more information on these organizations and how you can help them in their missions, please visit powerupgambia.org, bansanghospitalappeal.com, delmadgambia.org, or handinhealth.org.